Welcome to the Modern Day Naturopath podcast with Dr. Sue. Real talk for those craving deep healing whilst living in a modern day society. You'll be equipped with knowledge to make profound mind-body shifts that utilize ancient wisdom and will facilitate your healing once and for all. Inspired by Dr. Sue's chronic illness journey and all the real and raw pearls she has learned along the way. Come as you are. It's never too late to start.
Hi, this is Dr. Sue. Welcome back to the Modern Day Naturopath podcast. Today, I want to introduce a very special doctor on my team at Naturally Sue Wellness named Dr. Sparks, who I consider my right-hand woman. And today, I'm going to have her share about her expertise in the area of mold illness. And before we get started with all of that juicy information, I did want to share a little bit more about Dr. Sparks. So she is a naturopathic physician, a licensed acupuncturist. She also holds a master's in Chinese medicine. She is a mold expert. We actually met at SENM, which is now Sonoran University. It is the Naturopathic Medical School in Tempe, Arizona. We did a lot of same mentorships together. We shared in a lot of the same naturopathic philosophy, which is not always the case for naturopathic physicians. And I'm delighted to have her on my team. So first, I want to have you guys pause and go to Instagram and follow her Instagram handle. It is Dr. Sparks, Dr. Sparks, Sparks, ND, like naturopathic doctor, Dr. Sparks, ND. Welcome, Dr. Sparks. Thank you so much for being here.
Thank you so much for having me. I'm excited.
Me too. So I want to know more about your journey into naturopathic medicine before we talk about mold and kind of where you felt inspired to learn more in that particular area. Can you tell everyone what maybe inspired you to become a naturopath? Was this something you wanted to do since you were younger, or was this a career change for you? I'd love to learn more about your history, and I really want people to learn more about you.
Yeah. The funny thing is, I was introduced to alternative health basically when I was 8 years old because my mom couldn't walk. She started falling down and couldn't walk, and went to, every doctor, and they eventually told her it was in her head. And she finally saw a manipulative osteopath who did basically kind of cranial sacral work. And he told her that she had severe scoliosis and it was hurting her sciatic nerve. And, over the years worked on her. And with yoga, she was able to walk again.
Wow.
And yeah, this was after horrible things like she even did electric shock therapy.
No way.
And they, told her she was doing it for attention. So as you can see, a lot of us have those stories, I'm sure. And, there's a good story too, but mine was my origin story was that. And, so I was always interested in it. She always was trying new things like acupressure, acupuncture. For her menopause symptoms, she went to a naturopathic doctor who also did Chinese medicine and acupuncture. So then I was introduced to naturopathic medicine in my 20s that way, and was also seeing that naturopathic doctor and getting acupuncture for the first time, which was kind of an amazing story. I had a horrible chronic sinus infection that was, you can barely drive because it's so painful. And she's like, "You're going to get acupuncture." I said, "No way, don't put those needles in me." And then she forced me on the table basically and stuck them in my face. And within 30 seconds, I completely drained and healed and went,
Wow.
This is amazing. But I was still on this trajectory in my life where I was in theater, and then I got a bachelor's in fine arts in theater design and production. And from there worked in television and music videos, commercials, behind the scenes. Did that for about 15 years. And then just one day was reading a book that I'd read so many times, and there was this one little sentence that says something like, a true kind of healer can hem and haw about where they want to go in their life, but when they finally make the decision, they go with their whole heart. And I got this full chill in my body and said, I need to go back to school and become a naturopathic doctor.
Oh, that's beautiful. It's like one sentence, or sometimes we read that one thing and that really just resonated with you. You're like, this.
Yeah. And so I was working in television at the time, and at night was going back to get all my pre-med done, and then went to naturopathic med school and med you.
Mhm.
And then after that, I went to get a master's in Chinese medicine for 4 years.
Yeah, that's what I want to ask about because I thought she was a little bit cuckoo for
Oh, yeah.
wanting to go to another. So, if you've probably followed me for a while, I've shared about how, what's the word, arduous or it could be torture, some of us would call it, medical school was 33, credits a quarter. And it was, I mean, exams almost every day. The pressure was, I mean, enormous on us. And when we were done, we were done. We were at like burnt to a crisp. And then we find out that Dr. Sparks is going on another journey, which we thought we were super inspired. But you had the energy to go to school for another 4 years to become an acupuncturist. What do you think? I know you had that experience with acupuncture. Do you feel that was enough to say, I want to go for another 4 years? Or was there something else in school that maybe made you feel, because we did learn acupuncture in school too. Did you feel like it was the classes in school that we learned that you said, hey, I want to take this to the next level and get my LAC?
I actually think it's something you touched upon earlier when you were talking about the philosophy of medicine.
Mm.
Ooh, I just got another chill. Dr. Sunstein must be with us.
Yeah.
So,
Love it.
being a vitalistic naturopathic doctor is what I would call myself, is
Mhm.
someone who believes that the body can heal itself if you give it what it needs and take away what it doesn't need, get rid of the
Mhm.
obstacles to cure, and then have enough energy to do the healing. And I don't mean just like pep, I mean like chi,
Mhm.
and that also incorporates mental, emotional, spiritual chi. And when I realized that supplements and herbs do a wonderful job at helping us with people on their healing journeys, I always felt that to go a little bit further into energetic medicine is kind of the route for me, So I think it's all important, but I felt like for me, if I was going to really hit on the root cause of health and healing, I was going to need, we use homeopathy, and that's also an energetic medicine, which I love that medicine as well. But Chinese medicine and acupuncture, just having the experiences I did in clinic too, where people are having these wonderful recoveries, you're just kind of going, okay, I want to learn more. And the reason I decided to go on that journey with that school is because in the US, in the world, there is traditional Chinese medicine, which is taught in a way that's kind of the way we teach Western medicine. We have a diagnosis and then we do these things for that diagnosis. Classical Chinese medicine is actually usually an oral tradition that comes down through master to apprentice, and there is there are different types of medicine in there that you learn through those long-term kind of pathways. And our master who taught at our school, he's an 88th generation Taoist priest, and so he also was teaching kind of that root cause medicine, and that's why I wanted to go there and learn that.
That's fascinating. And I love how he was old. I mean, how old was he? I love learning from
We
what?
don't know how old he is. He looks young, but I think he's up there a bit. But
Just
yeah,
like,
but it's like to know that 88 generations of humans pass down this knowledge is just,
that's incredible. And I think also, and when Dr. Sparks mentioned, when she said I got chills, I want to give a shout out to Dr. She said, oh, it must be Dr. Sensenig here. So Dr. Sensenig was an dear, dear mentor of ours. I had shared a little bit about him in my first podcast. But if you didn't listen to that one yet, he was generous enough to let me shadow him even when I was in marketing advertising and deciding I wanted to change my career. And he was the main reason I changed my career. And I remember being in school telling Dr. Sparks, you got to come listen to Dr. Sensenig because he's doing a lecture. And I would like drag her into the room. And then I think after the first lecture, you got hooked. And then you were like hooked in learning from him. And then you even worked in his office. So I remember, right? You remember that day, right? I was like, please just come listen to him because he really taught vitalism. And, because a lot of times, a lot of naturopaths, and listen, there's nothing wrong with palliating or trying to help the patient feel comfortable and support them from not suffering with natural means, but that's not true vitalism, right? Like giving someone St. John's wort for their depression might help them temporarily in the interim, but what's the cause of their depression? So that's where, Dr. Sensitive would try to have us really get to that root cause and not use what they call green allopathy, like supplements for symptoms, right? Because that's not true vitalism, like what Dr. Sparks was talking about.
Yeah, and I mean, I kind of feel like what we call green allopathy is also can be called functional medicine, and it's
Yes.
great. And I think it's far superior in chronic conditions than what we have for our traditional healthcare, but it's still not going where he was talking about. He was talking about, like, I love the example he would say, a naturopath, a vitalistic naturopathic doctor, if you have the roof is leaking, the functional or the MD or someone in traditional care would just put a bucket under the leak, and a vitalist is going to go up on the roof and fix the roof.
I love that analogy. I have to use that. We have to share that more. But doesn't that make so much sense? And that's why, and listen, we absolutely think it's incredible if a medical doctor decides to want to go back to school and learn some functional medicine, holistic medicine. We're so happy that they're even giving vitamins and open to this medicine, but we want to just make sure that the vitamins that they're on are not just a list of stuff that's treating their symptom. Just like she said, we had to get to the roof. So that's okay. So that I wanted to ask you about. I was always curious about. I knew pieces of your acupuncture journey, but I really loved how you explained the difference between the classical Chinese medicine, and I think that would resonate with a lot of people. And then actually, so I graduated, and then I just started working as a naturopath. But of course, Dr. Sparks went back to school, and then you were seeing patients part-time throughout that, obviously, because you were in school. And then when she was done, what was happening was, I'm only one person. I was, slowly growing my practice, and there were patients that were reaching out, and I couldn't, of course, see everybody. And I really had to be very particular about who I felt would be someone that I could trust. Like if I was not available for them, who could be someone that I could fully, not even, if she took over the whole case and I never even had to supervise it, would I feel comfortable with? And it is you. And I can't, the decision I made to bring you onto the team, it's been what, oh my God, at least 5 years, more than that maybe, right?
Yeah, I think 4 or 5 years, somewhere in there.
4 or 5 years. I cannot tell you how grateful I am to have you. I mean, we have been able to talk about cases together. We will share patients, or there'll be patients who will say to me, hey, I have X, Y, and Z concerns. And, when we have a free consult, and I'm like, no, it's Sparks is your woman. She's the one I do, because she does have a really good background in mind body medicine, Lyme literate, mold literate. So I do want to just stop and thank you for what you've done for me, for this trust factor of being able to send patients, because I do not take referring people to someone else lightly. And so to be able to have you as someone I can trust, and the fact that all of my patients gush about how amazing you are, I'm just so thankful. So thank you so much for being in the practice.
Thank you for having me. It's been a great journey, and I've learned so much from you too. I didn't really know much about Lyme or mold when I started with you. I was, working on things like thyroid and gut and, all that more. And just working with you and learning from you actually inspired me to get that mold certification.
Oh my, I didn't actually know. Did I know that you, because I was actually going to ask you. So that's actually my next question. But before I ask you that about what made you decide to do this mold certification. So did you feel like when I said, hey, would you like to join my practice? Did you feel like it was a good fit because of, like we said before, the philosophies that we shared, that if we were to share a patient, right? Because it would be very difficult if we had patients that we shared, or were in a practice where we had a different philosophy of medicine. So was that a decision based on, okay, we both really have the same way that we practice medicine? Like, how was that decision for you? Because I know obviously to join someone else's practice, you don't take that lightly either.
Well, yeah. And it's exactly what you said, because I mean, there's probably, we graduated with 100-something people in our class, and there was probably a little more than a handful of people that I would work with because of the philosophy of medicine,
Mm-hmm.
right?
So
And it was mainly probably our mentorship group, because we also learned from Dr. Tom and biotherapeutic drainage and all that, which, as you know, when people aren't draining well, like, they're not healing well,
what
so it needs to be addressed. It's, so,
absolutely, and and that was actually something I mentioned before, and I'm happy you just said that about we did mentorships together. So before we get into this mold aspect, because I feel like this is a big part of how I actually started treating mold, I'll never forget this. So we used to do a mentorship, and Dr. Dixon Tom in Scottsdale, Arizona, he has a practice. I think it's ACBM, right? It's called
yeah.
right, ACBM. And he had all of these amazing therapies in the office. He would treat autoimmune patients, cancer patients, and he picked a select few people. I don't know, there was like 15 of us. I don't even remember, where we would go to his office, and on a Friday night, talk about dedication. I think it was like once or twice a month. I don't remember, something like that. And we used to learn about biotherapeutic drainage, which we don't learn in naturopathic medical school. So we had to go and learn this extra mentorship. And I remember learning about this and saying, if I didn't have this in my years of practice, I don't know how I would actually help a patient get to full healing. Or, I don't know if I would actually have the means with just supplements, because people really have this level of, their drainage pathways are not open. And I remember asking Dr. Tom in the mentorship, if someone has mold, because I remember I was in medical school with a patient, I believe, that had mold on one of the shifts. They said, what do you drain? Like, where do you start? And I remember him saying, you drain every organ system, because it affects every organ system. And I remembered that. And then through the years, after I had graduated and moved back to New York, I didn't really think I was exposed to mold, but I got diagnosed with Lyme disease at the time. And then I remember I did the Lyme treatment, and I was still sick. And I knew I had emotional stuff to deal with. And I talk about that in podcast 1. But I also felt like I might have been exposed to something. I don't know if you remember this. I sent you the picture, not as far as, but I opened up like the bottom of my cabinet in my kitchen, and there was like black mold. The bottom, like leaking. There was something leaking that I didn't even see. And I remember doing a real-time lab mycotoxins test. And it literally said I had black mold. And I was like, oh my God, well, no wonder. And then I started learning a little bit more about it, because I had Lyme disease. So then everybody who had Lyme disease almost like vibrated at my energy. So I was just starting to get a lot of these Lyme patients. And then all of these Lyme patients subsequently had mold, because our detox pathways are impaired. A lot of these same people have those like HLA mutations, genetic defects. So then I just started kind of experimenting with different things with different people, and the drainage, which I'm sure you'll talk about in a little bit, did help the most with these patients. But I want to ask you, so at the time we were treating naturopathically, which of course just giving the body what it needs, taking out the garbage. But what made you say, okay, I want to go and learn more about mold? I know you said obviously some of the patients and some of the stuff I was talking about kind of helped you in that direction, but was there anything else that fascinated you about mold? And then tell us a little bit about the process of you getting that certification, and a little bit more about that.
Yeah, well, I started seeing, like you said, more Lyme patients, more mold patients, and a lot of fatigue, right? Just generalized fatigue. We don't know where it's coming from patients. That was a big one.
Mm-hmm.
And I think back to before I started working with you, I still have a few people back then that I worked with that I'm like, oh, I bet they had mold, but I didn't, we were not taught mold and Lyme in naturopathic medical school. We have to get additional training to really learn how to deal with that. And, I mean, maybe they are now, but not when we were. And so it was kind of one of those things where I went, yes, I'm helping, but I want to make sure that I'm doing the most that I can and the best that I can. And Dr. Krista, she's kind of like a naturopathic mold guru, had a mold certification class. So I took that class. And it was an amazing class. And, since then I've been incorporating also the things that she taught. And, like any deep dive that you do on, if people were interested in hormones or people interested in Lyme, when you start doing a deep dive on that thing, it's just like, it's kind of be overwhelming, the amount of information that's in that one topic, and I still have more to learn. Of course, we all do. But I feel like I have a better grasp of it after, getting that certification.
Yes, Dr. Jill Krista, I've followed her on Instagram for a while. She's so inspiring. I love learning so much from her about mold. So the fact that she even did a certification course is amazing. And I love that you did that, because what we're seeing is people coming to us with these mysterious symptoms, right? Like they'll say, oh, it's, these symptoms that I can't get an answer to. And it could be chronic fatigue. It could be all sorts of symptoms. So before we go into the symptoms, can you share a little bit about, start elementary, from someone who's like, well, how do I know if I have mold? What is mold? Maybe from bare bones, and then we can kind of build from there, just in case there are people who really don't know much about this, to people who are advanced that do.
Yeah. Well, the big thing is, a lot of times, there'll be people, we get different kinds of people, right? We have the people who know that they had water damage in their house or their work or their car and have mold issues. Then what we most likely have are people who didn't know that they have mold, right? And I think that's the bigger reason for me to go back to school, was to learn how to find that, because you'll find mold in places you wouldn't even think of. Like, for example, a few of the guilty guys would be in a Keurig machine, or in your ice maker in your fridge, or the water that comes out of your fridge filter. I think Dr. Kristen just did a video talking about how they installed a new fridge filter, and 2 weeks later she did a test of the water, and ketoglobicin was there, which is a nasty mycotoxin. 2 weeks. I mean, they tell you can have those filters in your fridge for 6 months,
Wow.
So, yeah, and then here you are hydrating yourself. Oh, Dr. Spice, I'm doing such a good job drinking my water, and getting poisoned, right? So it's like, oh gosh.
Yeah, exactly. You're like, yeah, keep drinking your water. You're like, yeah, I'm drinking water, doc, but I'm feeling sicker. And we're like, oh, that doesn't make sense. But we're like, oh my God, what the heck is in your water?
Yeah, and then a lot of times, I mean, one of the big offenders are the front-loading washing machines. Dishwashers, things like that, underneath your fridge. So places that you wouldn't even think of. And then, like you saw, like under a sink, there was a leak. You didn't know about it, that kind of thing. Or windows or siding that's not on right. So it's not like you have a leak coming in through the ceiling, but there could be one in a window pane, So there's a lot of places. And I mean, if you're smelling a musty smell, it's there.
Yeah, exactly. And also, if you're not, right? Like, if people say to me, and they're like, I don't smell anything, I don't see anything. And like, I would love you to speak to that, because I'm like, it doesn't matter. But can you speak to that, where like, oh, I don't smell anything, there's nothing in my walls, I don't see anything on the outside, but that doesn't necessarily mean anything.
Correct. So usually the musty smell is more the spores, right? So spores are the fruiting body. They're the part of the mold that is going out to create a new colony, right? And those, I believe, are about 1/10 of a micron. Those are the things that, get into your respiratory system, can exacerbate things like asthma, COPD, bronchitis. You get a cough, get sinusitis, right? You get, I have a chronic sinus headache, or I can't seem to clear my sinuses. I've tried antibiotics so many times. Spores are usually the guys that you're going to see there. But then there's a thing called mycotoxins, which is a little less known in traditional medicine. And those are chemicals made by the fungus to fend off their territory from other fungi. So it's basically saying, like, I'm going to eat this food, you can't have it. And so it's trying to kill the other fungi, but it's also toxic. And so there's different mycotoxins based on the different species of mold. Things like Aspergillus or Stachybotrys. Like, there's different molds, and they all have different mycotoxins. And then there's, I think in the Vibrant test that we do, I think it's 33 different mycotoxins that we test for. And those are, I think, 0.001 microns. And they don't smell.
Yeah.
And those are the things that are getting in, also through respiratory, but also through skin, through food. And they are really toxic to, well, the one thing that they all have in common is their immune dysregulation, right? So if you have mycotoxin illness, you're going to have immune dysregulation. And then above and beyond that, different mycotoxins, focus in different places. A few of them cross the blood-brain barrier, which is scary, right? Then there's some that are carcinogenic, we call them, or can be cancer causing. And then there are some that dysregulate hormones, disrupt the gut function, so the kidney function. Basically, I have a list of over 100 symptoms in every single organ system that mold can cause.
Isn't that insane that there's that? And that's why so many people can't get well, because they go to their doctor. It could be overlapping with so many things. Like someone can have fatigue and they can have iron deficiency anemia, or someone can have fatigue and they can have mycotoxin exposure, right? Like there's so many similarities between different symptoms. And that's so helpful. I'm so happy that you broke that down, because I think people are confused with that. And I love to hear how you just explained how the mycotoxins, what they do, like you said, defend up their territory. And I want to ask you, with the symptoms, like I know it could be hundreds. What would you say is the most common that you're seeing? And also, I would love to see if you can share your experience too with what symptoms you were having. I remember you said personally you had this, and I know I would love you guys to go look on Dr. Sparks' Instagram. She showed, do you remember you did that reel with like how swollen, I think it was like the hives, the urticaria. Can you share a little bit about your experience, what symptoms you had, and then of course, what are the most common that you're seeing in your patients?
Yeah, definitely. So the ironic part of my story is that I didn't realize it was mold illness until 4 years later or 3 years later, when I took the mold certification class. In hindsight, I realized what it was.
Wow.
But I was living in an apartment that I was on the first floor. And I remember the landlord, I had asked, like, can I put my bike in the basement so I didn't have to have it in my bedroom? And she's like, well, I would let you, but it fills up with the water all the time, like literally fills up with water. We were near a river. And I was like, oh, okay. I had never been exposed to mold illness, so I didn't even think.
No problem.
Yeah. I said, oh, I'll just keep my bike up here. Oh my gosh, that whole basement was probably filled with mold. So about 4 months into living there, after a flu, I started getting hives on my legs. And at first I thought it was bed bugs. I was like, there's like little teeny hives. But then it started getting worse and worse and worse to the point where I felt like, I don't know, for people who have had histamine issues, you understand this, that the tissues get so inflamed and a lot of water comes to the tissue to kind of try to put the inflammation out, right? So then you get swelling, and then your skin feels very tight, and then you have the pain of the hive. So it feels like you have a sunburn and a million mosquito bites all at once. And it was like I had that, and also on my face. And here I was, just starting my naturopathic career, trying to give free talks, and felt like I looked like a monster. I ended up in the ER multiple times from rapid heartbeat, because of the histamine. It was really, really bad. And about 6 months after this started, I didn't know it was mold illness at the time. I moved into a new place, and it still took me a year and a half to heal from the mold. And here's the interesting thing. I had gone to our elders for help. But like you and I know, mold and Lyme are really not something that they talk a lot about.
They really don't, right? They really do. It's like you saw them, like I think I saw the best naturopathic physicians. And if they just are not in an endemic area, or it's not on their radar, it's not like they're almost like, it's sad because it's not that they're not good doctors. It's just
they're amazing.
Not on there. It's like, how did I see the best naturopathic doctors and no one knew I had Lyme disease? It's like, because we did, like you said before, we learned, like, I think it was like a PowerPoint in pathology, what was it? Infectious disease. I don't know. And I think it was like 3 slides about Lyme. And I think the only reason I knew anything about Lyme is because I was on a shift with Dr. Stage and someone came in with Lyme. So she taught us about it. But if you didn't get that, how would you? We didn't really know much. And it's funny. I
Right.
just want to share this really quickly because this is crazy. There was a post that I commented on. I think I shared this with you. I was getting harassed by some doctors because I said we
Oh, yeah.
barely learned about about Lyme in medical school, and medical doctors got very angry and said we learn a lot about it. I'm like, well, then why are you not even doing the correct test? And they got very upset and triggered by that. But we don't. We actually don't learn about that stuff.
Yeah.
So, right?
Yeah, you have to get additional education, whether you're an MD, ND, DO, it's like, it's just not, right now, it's not a common knowledge. I mean, I remember a family member getting diagnosed with chronic Lyme late 90s, early 2000s, but had suffered for like 10 years. And, again, it's in your head, that kind of stuff. And finally found someone that helped them. And, now it's more common. I think there's conferences where doctors are learning and teaching each other, but it's really kind of extracurricular to learn this stuff.
Right.
And
The LLMDs, like they're called LL or like Lyme literate,
right.
medical doctors, Lyme literate, and most of them like Lyme literate, naturopathic doctors. Wouldn't you agree? They usually the people who have done extra training in Lyme usually always know about mold because don't you often see what percentage of your patients, if you had to just say a guess, would you say? Because most of mine are combos, right? I have it's like Lyme mold together. Very rarely it's just mold for me particularly, but do you have a lot of patients who are just mold or do you see a lot of corresponding like Lyme/mold?
I do have a lot of just molds. I have a few just limes,
Okay.
but
Okay.
more just molds than just limes. And I think the reason for that is the mold is the immune dysregulator that lets things like Lyme, co-infection, EBV take hold.
Absolutely. And that's probably, I mean, so many things she said were important, but that's probably one of the most important takeaways is that creates this environment. I think I'll never forget. I went to a conference when I was first starting to learn about this. And I remember them saying, well, make sure you're always treating, you're always having to make sure you look for mold in a Lyme patient because it will reactivate a dormant Lyme infection. I had this like light bulb moment. Oh,
Mhm.
well, kind of like the preceding thing, right? Like you feel, let's say you get bit by a tick when you're 2 years old, 5 years old, 10 years old, you never have symptoms. All of a sudden you go into a water damaged building, you're living there, or like Dr. Sparks' basement that filled with river water, which is insane. And then all of a sudden now you're like, I have all these weird symptoms. So is it the mold? Is it the light? Now it's both probably because of
Yeah.
reactivation of it. Okay, that's super helpful. And would you say, oh, sorry, what were you going to say?
Well, the one thing I didn't say about this whole thing is that in the end, the thing that really kind of clinched my healing from the mold was I committed to meditating every night for 15 minutes and doing a daily walk. And I was also taking one Chinese herb, like a single herb, which they don't usually ever do. But those were like my 3 things that I did. And I did that for 4 months. Usually we're always talking about, oh, and do this and do that and do that. But I was like, I'm going to commit to these 3 things. And then in April of my second year of having hives, I all of a sudden started feeling feverish. And my hives, I had them under control for the most part for that final year, like with over-the-counter medications, like antihistamines. I'd have them here and there, but not like full body, right? Well, that April, I got full body hives, head to toe, eye swelling, lip swelling, and the fever. And I realized I don't have a cough. I don't have a sore throat. I don't have anything else. I think this is a healing crisis. And so for 2 days, I laid in my bed and drank water and broth and had a healing crisis. And then my hives started disappearing. And what would Dr. Sensenig say? They started disappearing from the top down.
Oh my God, I love this story so much. Can you tell people in layman's terms what a healing crisis is? Because it's not fun,
Yeah.
but it can be life-changing for a person who's trying to get well, who's been struggling with something like this.
Yeah. So the beginning thing to say is a healing crisis typically isn't as bad as the initial insult, and it's usually not as long as the initial insult, right? So obviously I had chronic hives for 2 years. I didn't have a healing crisis for 2 years. I had it for 2 days. And I had the hives, to the point where I ended up in the ER the first time. But this time it was just bad enough to keep me in bed, right? So it's not as bad. It's not as long, a healing crisis. The other thing is a healing crisis is different from a Herxheimer reaction, which a lot of people who, are on Instagram and learning about their health journeys with Lyme and mold will learn the word Herx, right? A Herx is when you're killing a bug or detoxing something faster than the body can eliminate it through the organs of elimination. And so you kind of get this backup of sludge, dead cells, dead immune cells, junk, right? And you can feel worse. That's a Herxheimer reaction. A healing crisis is when you have a chronic illness and you can't heal from that chronic illness on your own. And then you use like an outside influence, whether it be the meditation, the herb, homeopathy, acupuncture, whatever it is that we're using to help the body get to a place where it creates an acute reaction. So then the body then heals itself. And so you have to bring it from chronic back into acute. And then the body says, I don't want this anymore. I am now healthy enough to get rid of it. And it does. And there's a Herring's law of cure where there's 4 different laws there. It says that you'll heal from the most current to the oldest, the most important to the least important, from the top down and from the inside out. And not all of them have to happen, and they don't have to happen in any order. You can have one or more of these things happen during a healing crisis. But it's really great when you have skin conditions, right? Because you can actually see them heal from the top down.
Oh my goodness. When you say chills, I feel like Dr. Sensenig is like jumping around in heaven listening to us talk about this. Because he would say, I mentored him for so long, and everything he said, it's resonating so deeply inside of me. And he would always say, healing happens from top down, inside out, in reverse order, right? It's like those people who had like eczema as kids, and then all of a sudden they have this healing crisis, their eczema comes up, right? When they're like 4 years old. So I'm so happy you just talked about that, because with the healing crisis, people get scared, right?
Yeah.
It's like, they're like, what the hell is happening to me? I just said to my naturopath the other day when she told me I was having a healing crisis, I said, I think I probably had more healing crises than probably anyone I've ever met. I was like, can people have multiple? Do you feel like people, if they've had really chronic stuff, they can have multiple healing crises in their life? Do you believe that or seen that?
Yeah, there's different layers, right? And especially if you have different bugs, right? I mean, how many moldy people are we going to see that have Lyme, 1 co-infection, and EBV?
Right. Exactly. Right. Exactly. Absolutely. And do you feel like, if you had to say, looking at the patients you've seen, obviously in your experience, and we know there could be hundreds of symptoms that could be related to mold, what would you say are like, I don't know, your top 5 to 10 that you see like in your life? This is a red flag. I know this is likely mold. If you could even say that.
Well, I say the number one thing that I see is unexplained fatigue. So when we've done, like you said, we've run the CBC, we're looking for anemia, we've looked at adrenal function, we looked at thyroid function, we've done all those things, and we're still like, why? And then that's a big one. Chronic infections, it's healthy to get a cold or a flu once a year. But when they're getting them 3-4 times a year, something's going on. There's some immune dysregulation there. Sinus issues is a big one, especially for those people that have tried multiple rounds of antibiotics with no relief. I'm thinking mold. Food sensitivities that come out of nowhere. Like, oh, I've been fine my whole life and now I can't eat dairy or I can't eat eggs or whatever it is. GI issues are probably another big one that I see. I think we were going to talk about that with SIBO. And then skin, eczema and hives and things like that, because the immune is dysregulated, and the body, when it's trying, like, through drainage and our organs of eliminations, we talk about the body bucket all the time. When your organs of elimination are backed up with so much toxic debris, it will use the skin to try and, as a secondary organ of elimination, to try to relieve some of that toxicity.
Absolutely. Can you just speak a little bit more to that about when we see patients who, they're not eliminating potentially, the way they're supposed to through the bowel, through the kidney, right, through sweat. It's like that they end up like a lot of the skin conditions that we see, even like the eczemas and these quote unquote just dermatitis, which is just skin inflammation, right? It's like that there's almost like this is this way of getting stuff out, but this is not the ideal place to be getting stuff out.
Right. Yeah. I mean, that's the interesting thing. When we look at there's 5 main organs of elimination, right? You have the lungs, kidneys, the liver with GI or, intestines, the emotional state. Hello, we always forget about that one. And that includes stress. And then lastly, skin. So when skin's a primary organ of elimination, it's things like sweat and oil, right? So when you have a fever and you sweat it out, that's perfect. We want that to happen. But when we're using it as a secondary organ of elimination, another place where we do a lot of secondary organ of elimination is the uterus. So if you're having things like severe cramping, clots, menorrhagia, like a lot of bleeding, that might also be a buildup of toxicity, which, we know that's usually an estrogen dominant thing, right? And so in the drainage world, we're going, okay, well, that's too much estrogen, right? So that's
Right.
kind of a toxin to the body, right?
Right.
And so we use the skin in that way. And so things like eczema, things that are like I said, an immune dysregulation will flare to the skin in an unhealthy way when we're backed up.
Isn't that so helpful? Because a lot of us were looking at, everyone just slabs these steroid lotions on and these, because they're uncomfortable. But it's what's going on with our primary emunctories of getting stuff out. And I'm really happy you brought that up. And something else to what you just said to validate what you just said, when you said, yeah, one of the symptoms are people getting sick a lot or like, when you're seeing people with constant sicknesses. So just before this call, I had a patient send me a message. She had been sick over and over and over again for, going on 6 months. And then I just received a message that they just expedited a flu nosode to them because she wrote, we've been basically hit by another, she said plague in a joking way, plague in the house. And we're supposed to leave for vacation, SOS. And then she writes, and guess what? We just found mold in our bathroom and our bedroom. So then I think that might be a factor, she wrote with a question. So here you go to, so now I literally was just saying to myself, why? She eats healthy. She's on all these amazing vitamins and what's going on? And it's funny because I actually asked you about her in the past. Her mold test, I believe, came up negative at the time. So this patient actually, I believe I might have talked to you about her in the past where she had a mold test. Like, so just to back up a second, there are ways for us to test mold, and we can do so through regular blood testing for certain markers that we can test. Like we'll check for complement 4A or TGF beta, or we can do MMP9, MSH in certain places, VEGF. We can check for some of these, but also they have companies like Vibrant or Great Plains who do mycotoxin testing. And can you speak to why potentially, I think you shared this with me before, this is the same patient, her mold test came up completely negative. Do you think that her body was just not like potentially releasing the toxins into the urine? Or what do you think if someone's test comes up negative, but she's saying she has mold in her home that she just found?
Yeah. So, that's kind of where the nuances of getting that education in mold lie, because there's lots of different types of testing like you spoke about, and we a lot of times use the mycotoxin testing, right? So that's not the one you were talking about.
Yep.
And that's a urine test, and so the mycotoxins come out your urine, and then we see what you've been exposed to. The unfortunate part is, one, mycotoxins are fat soluble. So the body is really smart. And at first, it's going to start trying to put them in fat tissue to keep them away from vital organs. And then eventually, you're going to build up to the point where it's starting to hit vital organs and immune dysregulation, all that kind of thing. And that's probably where you're going to see more overflow. But then there are people who just are bad drainers and can't get it out of their body, and so you're going to see a negative urine test. And so then you might want to do an antibody test or a different type of test.
Oh, that's interesting to check. And also this also makes sense why we treat clinically, right? Like Lyme is a clinical diagnosis, right? There's a lot of times where you do a Lyme test and your immune system is not creating antibodies at the time and you're getting a negative, or they're doing the wrong test, or it's just not picking it up at the moment. So this is where it's like treat the person, right?
Right.
To try to listen to their clinical history. There's been so many patients that I just like treated as if, because what are we going to do? Are we going to just ignore when we've checked everything else and we're still having that instinctual feeling that's what's going on? So I'm happy that you shared that, because we don't want to just say, okay, well, because the test is negative, we're just going to now just ignore it, and then they're continuing to suffer. So we can just use their clinical symptoms and use our judgment and say, okay, this does sound like a mold case, or hey, you do have mold in your house. Your test is coming up negative in your, from a urine test from your own body. But what's more important, right? You're exhibiting symptoms of mold exposure. So we would just, in that sense, then we would give recommendations to treat that. And then I want to actually, that was my next question. So when we treat, or like we recommend things for people who have mold, and I know this could be so hard because it just really depends on the person and what they might need, but are there some like go-tos that you'll do first? Like what is kind of like your order of helping someone who needs to maybe detox from mold, and kind of walk me through a little bit of what you would do first, or maybe some supplements you might use, or different things you do in their house to help protect them.
Yeah, no, that's a good place to start. The number one thing, especially if we have that first call and we're thinking, okay, we're going to do a mycotoxin test, then we're going to give you some sort of drainer or possibly glutathione, which is the most potent antioxidant in the body, to help you try and get those mycotoxins out so we can actually get a positive test, right? So we would do that before you even take the urine test. Then glutathione is something that you can use the entire time that you're working with mold. It's kind of the go-to, but also remember glutathione, you don't, as a single therapy, it's great, but it's even better if you're using it with vitamin C and vitamin E, because they help do the redox reaction with each other, so they make, if you don't have enough vitamin C and vitamin E, it's hard for your body to recirculate it back to the active form of glutathione.
Oh, I love that. Okay.
So that's why too, people will say, well, why are you putting me on a multivitamin? Well, because most people have some deficiency somewhere, and rather than try to give you 10 different pills, like, oh, I think you need this vitamin C, or I think you need this, we'll just give you this multi to make sure you're at least getting the basics of what you need. And it needs to be a very good multivitamin with, active forms of the vitamins. Things that are doctor prescribed multivitamins are going to be way better than something you would get over the counter at a pharmacy.
Right, like a Centrum or something.
Yeah.
Quality.
I call that expensive poop.
Right. I say expensive pee.
Oh, okay. But and then, so those are some basics. Another thing, like I said before, mold mycotoxins are fat soluble. So, do you remember Dr. Krinian in our environmental medicine class?
Mm-hmm.
He always talked about the key to pollution is dilution, right?
Oh, yeah.
So if you have a fat soluble toxin, then you want to add more good fats, right? So you're kind of diluting those guys so they're not causing as much damage. So things like omega-3s, and then phosphatidylcholine or phosphatidylserine. If I have people who have more brain fog, I'm going to give them phosphatidylserine. If they're having more GI complaints, I'm probably going to give them more, or hormone complaints, I'm going to give them phosphatidylcholine.
Oh, I love that difference. Okay, that makes sense though. And the phosphatidyl, right? Because that is going to be that fat soluble. And right, that crosses the blood-brain barrier too, right? I don't know. Yeah, right. Okay, so that's why you're saying it helps with the brain fog, and then that also helped their mood too, right? Like just this phosphatidylserine, right? Just really calming and relaxing.
Yeah, it's also good for the people with insomnia, right?
Mm-hmm.
And then the other thing too that you just reminded me of is there is really such a thing as mold rage. And I've had a patient way back in the day that when I first started doing mold that was so angry, and partly because they had been to so many medical doctors who did basic labs and told them they were fine. that they were lashing out at me. And, as a human, I kind of shut down because I was like, I don't like being yelled at, As a doctor, I took a beat and just kind of went, oh, this could be mold rage. This might not be about me. You know what I mean? Like,
Oh, that's so hard, right? Because you're like, you have to separate doctor from like human being a person and be like, okay, I might give them the pass because I feel bad. Like the mold might be wrecking their brain, creating this like this feeling of just like, do you feel like the anger comes from, what do you feel like it's from? Do you feel like it's just from like this dislike, like just toxins in the brain? What do you think that anger can come from?
Yeah, I think it's toxins in the brain.
Wow, that's fascinating.
But then also remember, what do we use to detoxify our body? Liver, right? And that in Chinese medicine causes, liver qi stagnation. Liver qi stagnation is anger and irritability.
Oh, yeah, that makes complete sense. So did they start getting less angry as they were getting detoxed?
Yes. Well, and the funny thing is, like, because I was like, I think we need to end this call and start it another time, and we came back and I said, I think that this is mold. And they were like, what? And so we got talking about it and they finally started to calm down. And then as we started draining, their affect completely changed.
Oh my goodness. I'm sure just hearing this gives people like this sigh of relief because they're like, oh my God, where is this anger coming from? I thought it was my hormones. My hormones are okay. And what's going on? Why am I feeling this rage? But that makes complete sense. And this is why people don't realize that Lyme or mycotoxins can cause these personality type changes. I had one patient, I wrote an article about this. He was, rage, OCD. Now that you're reminding me, he also had rage, irritability, OCD-like thoughts, severe depression, apathy. He said he felt like his brain he had no dopamine. He was like just having these just constant obsessive thoughts. Have you seen OCD a lot?
Yes. Yeah.
Okay. Yep. Okay. That makes sense. And I want to also ask you that this has been one of the things that I have been trying to figure out for a long time. And I finally, when you said this to me, I think it was like a year ago, it was finally like the light bulb moment when we have these patients come to us who have been to either a million doctors for their SIBO, or they have been on antibiotics or even herbal protocols by a naturopath and they still have SIBO.
Mm-hmm.
Can you explain a little bit about the connection between mold and SIBO? And of course, there's emotional connection with SIBO, but can you share a little bit more about these patients that are showing up at SIBO and they're doing all of these treatments, spending all this money, even the naturopathic way, and they're not basically getting resolution?
Yeah, so it actually took a little while for me to even understand that connection between mold and SIBO and really mold and gut dysfunction, right? Because there can also be dysfunction in the large intestine from so for people who don't know what SIBO is small intestinal bacterial overgrowth. You have a little bit of, good bacterial flora in the small intestine, but the majority of it is in the large intestine. Sometimes with SIBO, you get good and bad guys kind of filling up the small intestine, causing symptoms. And like you said, when we're working on that, whether it's, traditional medicine or naturopathic medicine, we're trying to get rid of those bacteria that are colonizing the small intestine. And a lot of times, and we're using sometimes food elimination diets with it, right? Yeah, okay. And we're seeing some improvement, and then we're like, okay, good. And then they'll have kind of go backwards, and then, bring them forward, and then they're going back. Usually when they're relapsing is when I'm going, okay, there's something we're missing, and it's usually mold.
Absolutely.
Yeah.
Yep.
And so it's partly, I think, due to immune dysregulation. It's partly, I think, from what I understand, due to the myenteric plexus, which is the nerve plexus that is kind of getting the intestine to work correctly, right? To move peristalsis. And so when you're not moving, when you're stagnant, even in Chinese medicine, when you're stagnant, you're going to have issues. And so if you're having issues in your nervous system from mycotoxins, it's going to affect things like your gut. And then also remember, a lot of people that have chronic illness also have tons of stress.
Right.
So this stress, I mean, I always tell people, like, we can't out supplement a bad diet, but we also can't out supplement mold or Lyme or anything like that, or your stress. Like, the
Absolutely.
number one thing that people like, so when I have patients and I give them these health plans that I know that can be overwhelming sometimes, and I try to like give them, priorities, and my priority is always this: deep breathing before you eat and before you go to bed.
Oh my
And
God.
they think I'm crazy. And, 3 months, 4 months down the road, they'll start, it takes them a while to start. And then they go, my gut is so much better.
Yeah. 'Cause they're moving, right? It's like they took a minute to just
Yeah.
chill out and calm down. It's always the one, don't you feel like it's the suggestions that are like free and really wouldn't take them the longest, that take them the longest to do sometimes? It's like
Yep.
almost they want the fancy expensive supplements after they say they might not want those things, but they want those things to kind of fix them. But it's like it comes down to their own behavior. Like, oh, maybe I just need to take a breath before I breathe or
Yeah.
take a breath before I go to bed. I'm so
And
happy you
it's
mentioned that.
similar, with mold affecting that same plexus. We always talk, you hear on Instagram all the time, vagal tone, vagal tone. Vagal tone just means, are you in rest and digest? Or are you in fight or flight? Are you stressed out and in fight or flight? Or are you able to take, a minute of deep breaths, put your feet on the ground and feel grateful for your food and actually get into rest and digest? Because there's a reason we call it rest and digest. Because you can't digest without it.
Yeah, right, and you're referring to that what's called migrating, right, motor complex, and
Yeah.
that's why, right, you need that to be moving so that you don't develop SIBO, and also, right, don't you I think from some of my learning, the mold can colonize, right, in that
Yeah.
digestive tract, right? So that's another reason. So it's another hidden thing to think about. If you've gotten SIBO before and you had mold exposure, or you've done a bunch of stuff and it's actually not getting to a resolution, it's something to definitely look into. And I wanted to also just, I know we have a couple of minutes left. I want to make sure we talk a little bit about the ways to test for mold. And I know a lot of patients who have gone through this chronic illness journey, they've spent a lot of money along the way. And of course, like there are these amazing mold inspectors. And Dr. Sparks actually has, and we're going to add it to our website too, about, how to look for a good mold inspector. But with the patients who have spent a lot of money and they're like, hey, I just want to screen, I personally find it very helpful for patients to, as their first step, especially if they're overwhelmed with hearing about potentially them having mold, them just doing the microbalance mold Petri dishes have been really amazing ways for my patients to know they have mold in their house. They'll just do these air samples, and or they can do a tap test on furniture. And they tell you instructions on what to do. It comes with 6 plates. They're like $36. Do you have a discount code with them?
I do.
Yeah, so Dr. Sparks, share your discount code with them. Do you know what it is? Is it just Dr. Sparks?
I think it's Dr. Sparks ND.
Okay. If we think it's Dr. Sparks ND. If it's not, you can reach out to us. But they have these 6 plates for $36. It's a great way to screen. It's if you have more than 4 colonies, it's very likely that there's a problem in the home. And this has been a huge way for me to actually find out that the patient's going through this, and then that also for them to see, and then they have this aha moment, and then maybe they would get, right, Dr. Sparks, the mold inspector after that, because then they need to find the source, right? But it's a way to screen, in my opinion. Would you agree, especially for patients overwhelmed with this process?
Yeah, it's a great starting point, because it's also great for people that are having some financial constraints, right?
Right.
And then the one drawback is that you need to know about is, so the plate has agar on it, which is food for mold, right? And so when the mold spore lands on it, it's going to eat the food, it's going to grow, and it's going to form a colony, like she said. If you see more than 4 colonies, you might have a problem, right? Because it's normal to have some mold in your air. But that agar does not feed every type of mold, and one of the ones that it doesn't feed is black mold.
Oh, that's so
Yeah.
interesting.
So you could still have a problem and it not show, but it's a great starting point because if, for any of the other molds, if they're there, you're going to find them.
Right. And that's actually a great point because I had a patient, he's like, nothing came up. And I showed them at the company. They're like, no, keep searching. I know it's in there because I told them the symptoms. And he was one of the guys with the rage and OCD. And they said, no, it's definitely in there. And he then, I think he then did a sample somewhere else. Like he did a tap test on like under his furniture somewhere. And sure enough, and speaking of furniture, I just got a message on Instagram from someone who just told me that they tapped their mattress and it came up like I think it like filled up the
Oh,
can you believe that? And I actually, this which brings me another one. I had this patient who had a Tempur-Pedic bed. I'll never forget this. Like 5, 6 years ago, and she got rid of her bed, but she had this feeling something was wrong. So before she got rid of the bed, she opened it up and they sampled it, and there was black mold in her mattress.
no.
I know. Can you just imagine why there's some people, they're waking up and they're like, why am I sleeping 8 hours? I mean, besides just mold being in their environment, imagine laying on the source. I mean, and sure enough, she had got bitten by a tick in her life, didn't know it. And then she was that typical Lyme mold patient because now you're lying on a mattress, breathing in this. Could you imagine the nightmare of that?
Yeah, if you're a heavy sweater at night, you definitely want to rotate your mattress out every once in a while.
Oh, that's very true. Right. Because you're right.
Or get a mattress protector from sweat, because all
Yeah.
you need is 60% humidity in food, basically, for the mold to grow.
Oh my
And
God.
skin
Right.
cells are food. Dust is food. So they, and beds, I'm sorry, people, the beds and pillows are filled with dust mites and skin cells.
Oh my gosh. And people are like probably horrified, but this is so important. I know. I'm like thinking now, oh my God, I'm going to go
Well, you can vacuum your bed too.
vacuum your bed. And also EC3, the microbalance lab company. I don't know if you guys saw my story. Some of my patients saw it. They were cracking up at me. I left a food from, I don't know what was how I had this happen, but when I had gone on my trip to New York, I left like a package of something opened that had food and it was sitting in my travel bag in my bedroom. And I opened it up and it was moldy. So I, of course, freaked out. And then I talked to the microbalance people. They sent me a fogger and I fogged my entire room and my entire mattress. Have you ever seen those? Those are incredible.
That's great. Yeah, no, I've not used one of those.
Yeah, the foggers are great for people who have to move. And like obviously like my source, I removed it, right? Because I took out the food and I threw it away. So it's not like it was a leak in my wall
Right.
that I was like, then I was just going to fog things and think that everything was miraculously going to get better. But if let's just say you're in the mold, you do have a water damaged house, you want to at least, get your house at least as mycotoxin free as possible. You can, it's so gentle. You can like, she said, you can like spray each other, like you do on your closet, your clothes, your bed. So I just sprayed everything, the bag. It's just basically like this vapor that comes out of this fogger. And the one of the women in the company had shared her story with me that she has an autoimmune disease, and every time she feels like she's flaring, she thinks there might be something that's going on in her home. She'll just fog her house, and then she'll notice an immediate difference.
Wow.
Right. So I thought that was really interesting. Is there
But also remember their company, Microbalance, they're using, it's all natural products.
Yes, exactly. Thank you for saying that. It's all essential oil based, and their candles even have like research, like I think through real time labs to show that it removes spores from hairs. And on my Instagram, I actually showed a before and after of someone who used the candles, and then just to show the difference when they did the Petri dishes. So I thought that was also fascinating. Is there anything else you want to share before we close and I give people more information on you? This has been so helpful and enlightening. People are going to love this.
I hope so. Two things that came up in my mind. One is, do consider getting a good air filter. I know that you have a few that you recommend. What was the one that you love the most?
So I like Air Doctor. Air Doctor is my favorite. That one I do have a discount code for. It should be Naturally Sue. I do absolutely love that one. Or IQ Air is another good one. But I know you looked, Dr. Sparks, at Air Doctor, and it had the requirements that you said for people who want to make sure they're getting like that certain micron amount,
Yes.
right?
Yep. And the other one that I like is IntelliPure.
Oh, okay. I don't know about that one, so I'm gonna
And
look it up.
and the last thing I wanted to say was for the people who do get remediation or are, finding little bits of mold, the company we were talking about, Microbalance, they also have mold cleansers for your laundry and for top, surface stuff that are non-toxic. But when you get a remediation done, and I've seen this problem happen with patients, is that the guys come in, they do the remediation, and they leave, and then that room that was filled with mold for however long has a couch in it or has a rug in it or whatever. That needs to be changed out before the remediation, or during the remediation, or things that can't be cleaned you need to get rid of them.
Okay, but that's a part of why the fogger, if let's just say you wanted to keep your stuff,
Mm-hmm.
from what I understand, I think the fogger can
Help.
the people who want to leave their house because they have to either remediate or they want to move and they don't want to bring the mold to another, right? Like bring their items with mold to another area. So supposedly, and I can ask them to verify this, but from what I understand, they said that you can just spray the fog your belongings, including that, if you wanted to save money to throw everything out. Have you heard
Yeah, I
that?
mean, that's a good idea. And doing a top-down clean,
Yes.
cleaning the walls, cleaning anything you can think of cleaning before you move back in. That's going to set you up for success. Don't just count on the remediators because they're not going to clean everything. They're just going to work on the area that they need to be working on.
That's a really good point. And they actually even have, I don't know if you saw, they just came out with new wipes. They're like mold cleaning wipes and you can
I
use
didn't see that
all
yet.
over your house. Yeah, they're new. They come in like a little, like you pull the wipe out of the little jar and you can just, I go wipe happy and I just wipe down the
I love
whole
it.
house. We're mold obsessed. And one other thing we didn't mention, and we can literally talk for literal hours on this, and I'm going to have you back too, and we're going to talk more on different topics. But the other thing we didn't mention that, let's just say someone's like, hey, I can't afford a supplement right now, or hey, I'm very sensitive. I don't know if I can do this right now, or I don't know if I could do a drainer right now. Just sweating, right? Going into an infrared sauna is really, really great. Would you agree to help people to at least get started with detoxing from mold?
Yes and no.
Oh,
Well, so I'm glad you brought that up because I started thinking through this. I don't know if listen to, I think it's Dr. Pollack's 4th phase of water lecture. He talks about how when you use infrared, it changes the water structure within the cell. And when there's a protein, the water structures itself up against into a structured water up against the proteins. And then it kind of creates this near the cell membrane area for all the toxins to come out. So infrared saunas are really great at detox, right? But if you're one of the few people that feels worse with detox, I would say do just a regular sauna.
Oh, okay, that makes a lot of sense. And so that's why I'll say, because we have very sensitive patients. I'm so happy you mentioned that because I usually tell a patient to start really low and slow in a sauna, right? Because they can really feel sick. But that's really good to know between choosing an IR sauna that we think is always better. But if you're those few people, that you might actually just benefit from a regular sauna.
Exactly.
Oh, that's so good to know. I'm so happy I just asked you that. Okay, so that is one of my last questions. And so I want to let you guys know Dr. Sparks we do offer 10 to 15 minute consults in our practice. They are completely complimentary. We do this because we want to make sure that we are a good fit for you. So we have this conversation to see, what health concerns you're having. What have you tried? What have you not tried? What expectations are you looking from us, and then how we feel we can help. We do not take on patients. We do not feel we can help. So we are very honest of, sometimes I talk to the patient. I'm like, no, definitely, Sparks might be a better option for you, or a combination between us, or, hey, I think you might need to see this other doctor. So we do offer these. You can go to naturallysue.com. You can just put in your name, email, and then request a consult with Dr. Sparks to talk to her about this. And she also wrote an incredible article on mold that's actually trending on Google. And she's probably going to get very shy and embarrassed, but it's literally trending on Google. Um, it's about mold and how she addresses it. And it's a great way to have, at least, because I know we talked about a lot of info here, but a lot of the stuff we talked about was also on there. So you can check it out on our website, thenaturallysue.com. It's under our learning section. And then also a reminder to follow her on Instagram. It's drsparksnd. And then we're also going to put on our website a package that you can work with Dr. Sparks to help with your mold illness, whether you know you have mold or not. So stay tuned. I will send that out in an email. And then lastly, we are going to also put all of the supplements that Dr. Sparks has seen to help. Of course, these are not going to be specifically chosen for you. They're just things that we talked about today. If perhaps you wanted to do anything like a DIY, we will have a link that we can send you. So if you'd like, you could just reach out to us through our website or office at naturallysue.com or text us 212-652-2240 and ask for that link. We'll put a 15% discount on there for you for any of the supplements she mentioned today. And did I miss anything else?
I think that was it.
Everything. I am so grateful to have you on. We've talked about such a wealth of information. I cannot tell you how grateful people are going to be to hear this information, because they're not hearing this in a, they may get these pieces in social media, but I'm happy we kind of got to be able to talk about from start to finish through kind of our process and our thinking and other comorbidities, right, that can happen with people who have mold exposure. So thank you so much for joining. I'm so grateful to have you here today. Thank you, Dr. Sparks.
Thank you for having me.
See you soon.
Bye.
Thanks so much for listening to Modern Day Naturopath Podcast with Dr. Sue.